2 years ago today, we confirmed New Zealand's first COVID case. Now, despite the Omicron outbreak, we have one of the lowest case counts in the world.
So how has doing things differently set us up for what's ahead?
Across the globe, COVID cases number more than 400 million. But where the rest of the world's hit record highs, we've made headlines for our record lows, with more than 3/4 of our cases recorded in the last month. Now, as we ease restrictions amid our biggest outbreak, how does our response stack up internationally?
And Dr. Amish Adalja, Senior Scholar at the Johns Hopkins Centre for Health Security, is here now. Great to have you with us. 2 years into the pandemic, how does New Zealand's COVID approach compare to other countries?
New Zealand took a very different approach than many other countries, sticking to kind of a COVID-0 policy that many of us thought was not sustainable and was something that was eventually going to have to be replaced. And I think one of the other issues with the policy was that it was very, very blunt, very broad, treated all activities the same, indoor versus outdoor, and was kind of adhered to for a period of time that a lot of us thought was a little bit too long. But obviously, New Zealand had benefits in terms of the number of deaths. But what we really worried about there was that they weren't really reflecting what was going to happen with this virus eventually. And it sort of stunted the population's ability to learn how to risk calculate, to learn which activities were high risk, which ones were low risk.
So far, we have kept case numbers low and we've worked to get a double vax rate of 94% for people over the age of 12. Are we in a favourable position now to be easing restrictions now that we have this widespread outbreak?
The vaccination rate in New Zealand is very, very impressive, something that I wish we had here in the United States. And because of that vaccination rate, it's likely that, yes, you're going to have cases with Omicron because this is not something that really can be avoided. But those cases are increasingly going to be decoupled from hospitalizations and severe disease because you've got so much vaccine coverage. So I do think that this gives you a lot of flexibility to reduce the number of COVID mitigation measures that you have in place.
Are there any signs that COVID is close to becoming endemic globally? I mean, could Omicron be our final strain of the virus?
I do think that Omicron, because it is more immune evasive, because it's able to get around some of the immunity that prior infection, some of the immunity that vaccines provide, does represent what this virus is going to look like. It's going to be something that can reinfect us, but because of the immunity in the population, it's going to be milder. And I think this might be that step that this virus takes towards becoming a seasonal coronavirus. And I think that places like New Zealand, because of the vaccination rate, will likely immediately jump into the endemic stage because they won't see hospitals in crisis. That really is what differentiates for me something being a pandemic and being endemic. It's when you don't see hospitals worried about capacity.
Last week, our government said it would focus less on the daily case numbers and more on the number of hospitalizations and deaths. Why are those metrics more important?
When you think about SARS-CoV-2, the cause of COVID-19, this is a virus that can't be eradicated, it can't be eliminated. It's not going to magically go into bats. We're going to all eventually get COVID-19. The goal is to get it after you've been vaccinated so that it is mild. This is going to become something like a respiratory virus we deal with year in and year out. And the goal has always been to shift cases towards the mild side, not to eliminate something that can't be eliminated. So as countries have high levels of their population vaccinated, the focus has to be on preventing severe disease, making sure hospitals can operate, that they're not getting crushed in the intensive care unit. And that's achieved with vaccines, with antivirals, with monoclonal antibodies. So the number of cases, they're going to go up and down. There's going to be hotspots, there's going to be outbreaks, but if they're not translating into hospitalizations, you're in a very good place.
Thanks for your time, Amish. It's great to talk to you.
Thanks for having me.